My name is Dr. Kevin Winslow. I'm a board-certified reproductive endocrinologist, director of the Florida Institute for Reproductive Medicine. I'd like to speak to you today about a very new, exciting technology, that of egg freezing, the technical term being oocyte cryopreservation. This technology offers tremendous hope to at least three groups of women: those who may be faced with potentially sterilizing therapies, i.e. cancer therapies; those women who, for whatever reason, may need to postpone childbearing into their late 30s or early 40s; or couples who may require in vitro fertilization for pregnancy but who are morally, ethically opposed to freezing embryos. This is a very new technology, as I mentioned. There are only about 350 babies that have been born worldwide from frozen eggs. Because of this, this work should be done under an IRB-approved protocol. IRB stands for Institutional Review Board, meaning the programs that perform this work should answer to a board of their peers in terms of efficacy and safety. There are many programs advertising that they freeze eggs. Many of these programs have had few or no pregnancies from frozen eggs. It is therefore important to ask some key questions when considering a program. Again, ask if it's being done under an IRB-approved protocol. Ask about the number of babies that have actually been born from that program, not an affiliated program, but from that particular embryology lab. Ask about the efficiency of their technique, i.e. how many eggs were actually frozen to accomplish those pregnancies on average. Again, very high numbers may indicate that this isn't a feasible, practical option through that program. And ask about costs. Costs to freeze eggs should mimic those of a typical IVF cycle. Basically, the steps are very similar. And lastly, ask about any additional costs for ongoing storage. Costs to store eggs should mimic those for embryos, typically $100 to $300 a year. So if you're considering oocyte cryopreservation, do your homework. Fertility preservation is a very important issue that usually only gives you one chance to get right.